Hi everyone, I'm Kemol, and we're here for another episode of Frank Discussions. I'm joined by Kobe Smith, the Executive Director of the Guyana Responsible Parenthood Association. The organization does a lot of incredible work, including providing services, um, sexual and reproductive health and rights services, and advocacy. So there's a lot that we can talk about with Kobe. Hi, Kobe. How are you, first of all?
Hi, come on. I am energized and relaxed. I think those are two adjectives I can come up with.
Okay, great. Um, Tell me about yourself before we get into GRP.
Good. So I'm Kobe Smith. I'm 27 years old, even though I look like 37. Sometimes I have to tell people, I'm 27 and I'm not 30 as yet. Um, I am an advocate for sexual and reproductive health and rights. I also, in terms of personally, I'm motherless. And I think the loss of my mother to ovarian cancer 9 years ago has significantly contributed to my advocacy and professional life. I use her passing as motivation to ensure that women and girls in Guyana and around the world have access to life saving health services. And that is important for me, ensuring that other women and girls do not go through what she endured. And I am also legally trained. I think I use my legal training as a law graduate to ensure that I defend and protect the rights of the vulnerable. That is critical to my being and the work that I put forward in society.
All right, thank you, Kobe. Could you tell me about the reach of the services and advocacy of the GRPA across the country?
Right. So the Guyana Responsible Parenthood Association, GRPA, is the leading sexual and reproductive health provider in Guyana. This year, we're actually celebrating 50 years of service to the nation. I unashamedly say that there isn't another NGO in the country that does our work and has the presence and existence like GRPA does. We were registered in 1975, post independence. That's about 9 years after Guyana gained independence.
Yeah.
That's also 5 years before we got the 1980 Constitution. And it's really critical and important considering the push and the advocacy for reproductive rights and justice in Guyana. And so GRPA serves all regions. We have our main presence in Georgetown
Yeah.
on Commonwealth Street with our clinic and our office. We provide a range of sexual and reproductive health services, including HIV testing and screening, STI screening, cancer services, which is critical and important. We also have a laboratory that provides blood testing. A lot of people don't know that. Like, people just think that GRP is this place that you just come and get like HIV testing. But you can come and do your blood testing, HbA1c, lipid profile, kidney function, cholesterol, and so forth. Important to our work is the provision of abortion care in our country.
Yeah.
That is one of our leading services, perhaps what we're generally known for in Guyana. And we also provide counseling and psychosocial support for women, for girls, for men, for boys, anyone who's in need as it relates to relationships, family planning, and other issues that people might be facing.
So you have a physical presence in all regions, is that it?
So not a permanent presence. So we do have collaborations with the United Nations Population Fund. And so,
Yeah.
for example, we have a program that is the Equal SRH project that focuses on regions 1, 7, 8, and 9.
Yeah.
And the aim of that project is to provide reproductive health services, sexual and reproductive health services to indigenous and migrant communities. Of course, the challenges with indigenous communities in terms of lack of access.
Yes.
And we also know the spillover of the migrant population in regions 1, 7, 8, and 9.
Yeah.
And so we provide HIV testing, we provide contraceptives, we also provide training and support for young people around sex education to ensure that they not just respond to the challenge of adolescent pregnancy, but also to reduce the high incidence of HIV and other unmet needs as it relates to sexual and reproductive health.
Okay. So, Guyana recorded at least 449 new cases of HIV infection in 2025, according to recent comments from the Health Minister, Dr. Frank Anthony. So, I think this would be a good place to start. Because I think this revelation, it raises a lot of critical questions about the extent to which the public is aware enough and care about the available means that they have to prevent infection. So could you talk first about preventative measures that can be taken? I also want to talk about, what happens when somebody finds out they're infected, but what can people do to prevent themselves from getting infected with HIV?
Great. I would also want to add to the stat that you shared, Kemol,
Yeah.
that it's disproportionately affecting young people.
Yeah.
I think the age range is like 25 to 39. That is the group that the data is showing has the highest rate of HIV or the newer infections.
Yeah.
And it leads us to question the why. Culture, social behavior. We also need to continuously push the need for comprehensive sexuality education. And GRP has been pushing that for decades. And we need to prioritize sex education, both for in school and out of school youth. Of course, we have the HFLE program in the education system, which serves its purpose, but we continue to advocate for robust inclusion of sexual and reproductive health components within the HFLE framework. We call it sex education because that is important. We need to understand that there are a lot of people who don't have access to information and education. And we can't assume, and it's generally in our society and culture, that because young people have access to Facebook or Twitter, TikTok, that they have the information. That's not the case. And that's why we've been unapologetic and we've been bold about what we put out in the public when it comes to sex. Because we're not too sure that people are actually having the information to make those informed decisions. And we cannot assume, because the question really and truly, Kamal, is the why. Why, if we have 10,000 people generally in Guyana that's infected with HIV, and in 1 year we have about close to 500, that is a problem.
Yeah.
And so we have to understand whether we have culturally sensitive, age-appropriate, culturally relevant, rights-based information that is consistent, that is not just on the television, because I don't know that people look at the television. But let's go where young people are. They're on social media. They're in schools. They are... Where else are young people, I think?
They're everywhere.
Everywhere. But I'm saying we need to be able to package information in a way that is relatable. And if, in fact, we know that Guyana has been fighting HIV for at least 30 years, why in 2025, after so much progress, and props to the Ministry of Health, that we're in this particular place? And so we have to be able to promote condom use. In addition to the information and education that I spoke about, we have to also promote PrEP, pre-exposure prophylaxis, which is HIV medication that's given to persons who are HIV negative that, of course, have a high risk of exposure. PrEP prevents the contraction of HIV. And that is readily and freely available. Persons can come into GRPA taxes that. They can go to the National AIDS Program Secretariat, but it's there. And I think we also need to be candid and honest and open to say, Kamal, if we have a situation in this country where condoms are free, PrEP is free,
It's free.
social media is free, right? Google is free. Young people and people in general are going to have to take a bit more accountability for actions. Because we can't just sit and say, oh my God, 500 cases is the government's fault, or GRP has to do this or that, or the Ministry of Health or NAPS, right? Because in defense of the persons who are working in the space, right, and who are actually investing, like, these things are there, right? And of course, there's always the need to ensure that in every community, in every health center, these services are available. But in the grand scheme of things, these services are, of course, available. And we do recognize that there is the need to address the significant barriers that remain. And the Minister of Health touched it when he made the announcement a couple of days ago. He
Yeah.
made a good point to say that when people go to a health center, they're concerned about who do I know there? Who from my community, or who know my aunt or my uncle, or my mother, my father? That is a lingering concern. And so I know that we, and I want to say we as GRPA, we have invested through support of UNFPA to train healthcare workers. I know that NAPS is also training healthcare workers to understand these issues, and we must continue that so that persons can feel comfortable, particularly persons of the LGBTQ plus community, sex workers, and others, young people, because persons should be able to walk into any health facility and access care. And if they
Yeah.
don't, then that's a breach of their constitutional rights, because we have a right to health. And then there are other legislation like the Health Facilities Licensing Act. I hope I got it right. My God. The Health Licensing Facilities Act, I think it is, that talks about the right of access. And we talk about breaking down the barriers or the issues pertaining to discrimination. And so while we know that, yes, PrEP is available, testing is readily available, we have to understand the why. And I do think that this is a time for us, and I want to say us as GRPA, even the ministry and other actors, that if we have a situation in this country with about 500 reported cases, let's recognize that too. Because if you're into stats, you know that it's higher than that.
Yeah.
Because there are people who are just not testing.
Right.
We need to understand the why. And traditionally in our culture, we have not been listening to people. What does the data say? Like, what are the behaviors? What can we do? And there are people who, like, I was speaking to someone today at, we had the World AIDS Day walk, which a lot of people didn't turn out to, but we hope that people turn out more. And we were talking about progress that Guyana, has made, and whether we're weary or tired of doing the same things over and over. Because there are people who will say, well, we've been doing these things for 30 years. Condoms, condomize, get tested. These things have been in your ears constantly. And we're yet still in 2025 with this particular challenge. And so it is for us to really and truly come to the place where we ask these questions to people who are affected. Like, what more can we do? Like, why when we put out an ad or a post on Facebook in some generic way, people don't respond to it?
Yeah.
Why we have these billboards that are up in the city, and yet still people are not taking PrEP in the way that we want them to? It's one thing to say that we have these particular things, but if people are not coming forward for it, then we need to not just say that, yes, the data says X and Y, but really understand what more can we do to support people to bring them to that particular place. That's critical and key.
There seems to be an impression among some people that it's a gay infection, even though they know that everybody can get it.
Yeah.
The idea is that that community is a vulnerable community that's more likely to be infected. But one of the things the minister said is that he saw that many pregnant women, for example, are getting infected, and it's concerning because they're not going to clinic when they're pregnant, and they end up giving birth, and then the baby's infected too. And I think of how I get the opportunity to be responsible so that I can prevent myself from getting infected.
Right.
But there are some people being born without that opportunity. And so how much of this is just, a gay infection as opposed to an everybody infection?
Well, I think that it is ridiculous nonsense, and it harkens back to the homophobic culture that we have in the country. And I mean, anybody who wants to oppose that, I feel like they need to just check themselves, because that's foolish to not believe that we have a homophobic, or we live in a homophobic society. And so that kind of ignorance that people have come from that particular place. Because HIV doesn't discriminate. Of course, there are particular populations of people that are at a higher risk.
Yeah.
But the challenge is that when we use that kind of framing, it prevents people from getting tested. It prevents them from showing up to a health center because they feel like they're going to be judged, and they feel like people go, "Oh my God, there's a gay thing." Well, in Guyana, people don't really say gay, it's an anti-ban thing,
Yeah.
which is problematic, right? And it contributes to the culture of violence, the culture of discrimination that we really and truly have to address if we're really going to address it. And I say to people all the time, HIV is a pandemic, just like COVID. It has, when you look at the definition of a pandemic, it affects all people across borders. Like it doesn't care who you are. And when we take stock of that, perhaps we're going to do a better job at recognizing that we need to move past pinpointing, oh, he's gay and she's trans or whatever. Like those kinds of categorizations don't make sense because it doesn't stop the infection, right? What it does is that it prevents people from being tested, which is a problem. And so we really and truly have to address stigma and discrimination in our country and our culture because it does exist. I'm not saying that every single person in Guyana is homophobic. That's not what I'm saying, but I'm saying it remains the case. Like you can go on social media and see that. And I think that we're at a time now where, and we talk about it a lot in the space as like advocates and service providers about, like you have these, I don't know if I call them influencers, to be honest, because I feel like we use this term so cavalierly, like anybody with a microphone or a Facebook page. But if you have a situation where somebody has 5,000 followers or views on somebody, when I see some of these things, I'm like, suppose we could go online and talk about like prep, which is like a boring term for a lot of people. If you bring some of these quote unquote influencers to address these issues, perhaps we would turn the corner, I think. I mean, an audience of about 10,000 people, when you see these people behaving in different ways, I'm like, can we like use some of them to like do that?
Yeah.
Maybe we're going to have to pay them, but we don't pay them to like do their stuff online. But I'm saying, I make the point to say, Kemol, that we have to perhaps look at creative and innovative ways. And we know that there is a section of the Guyanese population that responds to certain ways and means of communication.
And GRPA has been trying those means
Well,
out.
we have tried those memes, and there are people who have criticized us for it. Like I have personal friends who would call and say, "Oh my God, Kobe, like you're overdoing it." I'm like, you can unfollow us. Like you don't have to like see that, because I feel like it comes from this problematic place where sex and sexuality have always been taboo. Like, what is wrong with saying that we're going to take a banana and have an orange and put the banana in the orange to make a point about sex, to make the point about orgasms in a sex positive way, right? Or you have different fruits to say, you know, a tomato is going to be a small penis. And a banana is going to be a large one. Not to discriminate because they got different sizes of penises.
Right.
But there is this kind of thing where there's some people, oh my God, let's not talk about that. But it's like, people have penises. People have vaginas. People are having sex. Like young people, we know that young people are having sex.
Yes.
And it's not necessarily heteronormative kind of sex. People are having all kinds of sex, right? And I think if we really and truly want to move the needle in addressing sexual health and making the conversation more sex positive, and I always say to people, our first exposure to sex education was in school, and the first thing they tell you about is HIV/AIDS. Like, it's so problematic. Like, when you talk to a lot of young people years ago, I'm talking about like people who left school like maybe 15 years ago or so, it's like you see a vagina that got some kind of thing coming out or whatever, and it's like that should not be somebody's first, you know, exposure to sex education, because there's much more to sex. Like, sex is an amazing thing. It's an amazing thing when it's done responsibly. It's an amazing thing when it's done with consent. Like, those are things that we don't talk about, right? When nobody should force you or coerce you or intimidate you to engage in acts that you don't want to. Like those are conversations that we seriously need to bring to the fore, instead of the black and white kind of narrative. And the reality, Kamal, is that we have to ask the question: has it worked? Because again, 500 reported cases.
Yeah.
We're gonna have to come into our room to ask, and even us at GRPA, like, what are we doing, and whether we think or find it impactful. And again, this is not just for GRPA. This is for every single actor. This is also for families. This is for parents, right? Because HIV infects, but it also affects
Yeah.
families. And we need to come to that place where we're having these honest conversations, because we don't. Like, this is like perhaps the only, I know you say it's not another podcast, but it's like a show that talks about these issues. Like, I don't know of any other that has done that.
Yeah.
And if I miss anyone, then I apologize. But really and truly, we're not centering these issues, even in the media. We only hear about it when it's reported that we have these cases.
That's true.
Like, we need to really and truly reflect and think about what has worked and what hasn't.
Now, let's talk about what happens when someone gets infected, because these 449 people, they do need to go and live on their full lives, and they can. So what happens after someone gets infected?
Right. Well, it is a choice. So, first of all, it's a choice for people to want to be tested. And two, it is also their choice to determine and decide whether they would like to go on treatment. And so nobody can be forced to go on treatment. And so when that person tests positive, there's an entire protocol that is recommended by the National AIDS Program Secretariat. And so depending on the particular case, before the person gets on ARVs, because people think that when you test for HIV, then or you're positive, then the next 5 minutes on the same day you get the ARVs. No.
Okay.
It depends, because, for example, persons are screened for TB, and if in fact there's any kind of TB, any strain of TB, then the TB has to be treated first before the person gets on ARVs. And so there's an entire process. And so that may not be the case for everyone, because not every person who tests positive for HIV has TB, but there's a process of the screening, of the other screening to be done before the person goes on the ARVs.
Okay.
And one of the things we want to make clear to someone, or people generally, is that you can be living on the East Coast of Demerara. And let's say, for example, you go to, I don't know, a testing site. Let's say you come to GRPA. Or let me not use GRPA. Let's say you go to GPHC, the NCTC, and you get tested and you test positive, and you tell the facility, oh, I live in, give me a community in the East Coast, Peasants. And you're concerned that your aunt who lives with you, or who knows your mother or somebody who knows your mother, works at the health center. You don't have to go to that health center to get your medication. You can talk to the testing site, and they can then recommend that you go to another site that you're comfortable with. And so we want to give people that kind of option, because there are dozens and even hundreds of people that are not going to the health centers within their communities for their treatment. And while some people may want to say, but oh my God, we got to force the healthcare workers to make it possible for the uncomfortable for them to come. Yes, of course, in a perfect world. But I think the comfortability and the peace of mind of patients are priority. And if in fact there are alternatives for them to go, then they should. I prefer persons to come to GRPA, because we, again, a lot of people don't know that we are a care and treatment site. And so we not just test for HIV, we also provide the treatment. We provide the ARVs. And so if there are persons out there who are not comfortable going to the facility in their community, of course, GRPA is safe, confidential, and you can definitely come to us. But I just wanted to make that point, because there are people who are, and the minister made the point when he made the announcement that people are not always comfortable at the health center that is in their community.
Yes.
And so people need to know that you don't have to go to that health center. You can go to any health center, and they're required to ensure that you have the treatment that you require.
Okay, so one of the things you said was that going on the ARVs is a choice. I just wanted to, before I move on to the next topic, do some people choose not to take it?
Well, yeah, there are some people who choose not to for different reasons. And of course, we make the point that if you don't use your ARVs, then you die. But we also want to make the case that HIV is not a death sentence. There are people who live for decades. There are people who are elderly and are living and are healthy. And we also want to make the point that undetectable means untransmissible, right? And so if somebody tests positive, eats healthy, takes their medication, there could be a time when they test back again and they turn up on the results, it shows negative.
Yeah.
And that means, well, it also means scientifically that you cannot transmit. And so there's this kind of narrative where people, oh my God, I have HIV and like it's the end of my life. I gotta like go on a table or a bed and just lay there and don't do anything else. Like it's not a death sentence. Get tested, get treated, and live and lead healthy lives. The alternative is of course death. Because if you are positive and you don't take any medication, then that's a problem. And that also exacerbates the public health challenge.
Yeah.
I also said to a colleague earlier today that we seem to just think narrowly about HIV and other health issues. There are also economic issues. Like there's this economic or financial burden that a government has. Because you could just imagine a government has to provide medication for 10,000 people, when in fact, that money could be used or could be invested in other particular areas. But of course, the government has a responsibility, and the government is doing that. But I'm just saying that it's not just a public health issue.
Yeah.
It's financial, it's economic. And we know with the terrible cuts to humanitarian aid, thank God the Guyanese government is able to cushion or foot the bill for HIV medication. There's some countries around the world where they have serious problems because they were looking at certain governments. Well, I don't want to like call the names of the governments because it's not like a political show, but like people are going to die, right? In those countries that don't have the access. And so we have a situation where we have a Ministry of Health that is investing in free medication. You have to go and pay for this medication. And so that's why I said earlier, Kemol, at some point people gotta have to understand that it's up to you now because it's available, right? In spite of the barriers, because there are things that we can do to get around the barriers, but we need to be a bit more, we need to hold ourselves accountable.
Okay, I get that. Now, I want to talk about abortion a bit. Guyana has very progressive abortion legislation with respect to the extent of the freedom a woman has
Right.
to terminate her pregnancy. We've had that in place for about 30 years. But there are still attitudes towards abortion. Could you talk about some of the work that GRPA has done to try to raise awareness and like break the misconceptions about what abortion is?
Yeah. So GRPA provides, as we know, medication and surgical abortions at perhaps the best rates in the country. Like privately, it's like, I don't know, people are affording to go like other private facilities, but we not just provide it in a way that is affordable, but we also ensure that we take ownership of the narrative. One of the things GRPA would have done is we would have trained advocates in responding to abortion stigma. One of the things we found is that we would make a post for abortions. Abortion is legal in Guyana, or come to GRPA for abortions. and people are in the comments like, "Oh my God, it's murder and what the Bible says and God and ugh." And I'm like, go on your own page and like do that crap. And I say to the social media team, like, delete these people, like block them, like because anybody who has been pregnant or anybody who has endured an abortion, those people will tell you that it could be a traumatic experience. It but not just traumatic, it could be emotional. And people who don't want abortions who don't believe in abortions, well, I can't curse, but they should just be quiet. Like, you don't support abortion, then don't have one. And if you are a male and you don't support abortions, then like that's your business. Like, just shut up and like allow people the freedom to do that.
Right.
And so I want to say that the addressing abortion stigma is important, and so we've done trainings on that to let people be a bit more empowered to neutralize those problematic arguments against abortion. We also are unapologetic on social media about abortion rights. There exists significant legal illiteracy in Guyana. Like, when we talk about literacy in Guyana, we think about it like formal education, maths, English, whatever. But there's also legal illiteracy in Guyana. And people need to know about their rights under the law, to know that you can be a woman or a girl and become pregnant and you don't need the permission of your parent or your partner to get an abortion. So if you're 15 years old and you become pregnant, you don't need to go and ask your mother or your father at home if you can come to GRPA or go to GPHC for an abortion. That's in the law. And we want people to understand that. Of course, if in fact there is a situation of rape, then of course there's a Sexual Offences Act and we need to get that reported. I mean, those things can be in place, or those things are in place. But women and girls can actually walk into a health center that provides an abortion and request it as of choice, as a right. In some countries, you need to prove that, the health or the well-being of the woman is at risk, and then you get it. I mean, we don't have that here. And so we try to provide that kind of information to people to know that they control that. Of course, there's the whole gestational periods, about 8 weeks. And then, of course, if you go beyond 10 and 12 and 16, you need, physicians to authorize, because, of course, the risks increase. But again, there are a lot of people who don't know, number one, that abortion is legal. Number two, what are the methods? And number three, where they can go. And four, there's the issue of affordability. People need to know where to go to get these services at an affordable rate. And then the other part of it is that we don't just talk about abortion care. We also talk about post-abortion care, where we talk about contraceptives. So yes, you had an abortion, but what's your plan after this abortion? Is it that you would like to have children? How many children? And if you don't, you have implants, you have intrauterine devices, you have pills, you have, other options that are available at GRPA. And one of the things we are working on with support from the UNFPA is that we're developing pre and post-abortion guidelines, also with the support of the Ministry of Health, to ensure that healthcare providers as well understand what these protocols are and the guidelines are, to ensure that abortion remains safe in Guyana. That's really important. But again, the information people need, and we need to package it in a way that they can understand, they can consume, and not just like post a bunch of laws, because people are not going to read that. Like tidbits online. We really want to continue that because that's important. And that can, of course, save somebody's life and also save their future. Like, that's important.
Okay, I'm going to ask you one more question before we close. Why is it important for a girl to be able to make that decision on her own? Because we know typically for medical procedures, you have to get the permission from your parents. Why is it that a girl can make that decision on her own?
Well, it is a matter of bodily autonomy. It's a matter of human rights.
Yeah.
And it is something that we want to keep embedded in our culture.
Yeah.
Because, again, when legislation is crafted, we look at perhaps what exactly was the intentionality of the framers of the legislation when they wrote that, a woman or a girl can proceed with an abortion without the permission of a parent or partner. In their mind, when they wrote this law in 1995, 30 years ago, perhaps there was a Guyana that was conservative in a way. Perhaps there were parents that were not in support of abortion care. And you could just imagine what the alternative was.
Sometimes the father is, their family member.
Correct. And so you don't want a situation where persons who are perpetrators of sexual violence, in a lot of cases, it's persons who are known to survivors. You don't want those persons to have decision-making authority over the bodies of survivors. And so that is critical and key. But it also comes back to bodily autonomy and the notion that women and girls own their bodies, and no one should be able to tell a woman what to do with her womb and what to do with her future. That is really critical, and we need to take stock of the fact that we do have some privileges in the country, because Guyana is only one of perhaps two countries in the Caribbean, I think Cuba and Barbados, that have abortion as a right. That is problematic, right? You could just imagine if we didn't. And so we want to be able to safeguard that, but I want to say to people, let's not be complacent, because we live in a world where some of the highest courts in some countries have reached their lowest points. Like, you have courts in some countries that have rolled back on like 50 years of precedent and decided we no longer have these rights. And so let's not be complacent. Let's be vocal about the fact that it exists and that we want to protect it. But also, 30 years after the passage of the Medical Termination of Pregnancy Act, we should be talking about how we can improve it. Just like how we would have improved the the Domestic Violence Act of 1996 with the Family Violence Act of 2024, we should come to the place. Ministry of Health should be bringing in providers, should be bringing in women into a room to talk about 30 years of implementation of this act and what can we do for the next 30 years. Should we increase the gestational period? Should we ensure that, or guarantee that mid-level providers like midwives in some far-flung communities should be able to provide medication abortion with, through telemedicine or telehealth or whatever? Because, if you have 10 regions with dozens of communities, all those communities don't have abortion access and abortion care. And so moving forward, we need to understand, how can people get access to this critical service when we know that there are unplanned pregnancies, when we know that also Guyana has one of the highest rates of adolescent pregnancy in the region. And so I think we need to be having those kinds of conversations to really understand how we can improve or further improve the health and well-being of women and girls in Guyana.
All right, thank you, Kobe. There were so many issues that I wanted to ask you about, but in the interest of time, even the few that we spoke about, I think there's so much more that can be said. But time is out, so I thank you so much for being here, and I hope I can have you again on.
Sure.
All
Thank
right.
you.
Now, you've heard from Kobe and the work that the GRPA is doing. Of course, there's more that you can learn if you call up GRP or visit them to find out about the work, the services they provide, the advocacy that they're doing, and all of those issues that I couldn't ask about because time ran out. You can also leave your thoughts in the comments, and thank you so much for joining us again this week on Frank Discussions. Goodbye.